On Viewpoint today, we address the latest on COVID-19 here and over in the US as bivalent vaccines, boosters that is, look to be available to the public this autumn. Also here in South Korea, authorities have announced a further ease in restrictions to commemorate this year's Chuseok celebrations. For more, I have Professor Kim Moon Kyu from Yonsei University here in the studio. Professor Kim, welcome back.
Thank you for having me.
I also have Professor Peter Chin Hong at the University of California, San Francisco, live on the line. Professor Chin Hong, it's a pleasure to see you again.
Always a great time, Sunny. Thank you for having me.
Right. Professor Kim, let's start with a few words on the government's latest decision to eliminate the requirement for negative COVID-19 test results upon entry into South Korea starting September 3rd, which would be this coming Saturday. What are your thoughts on this decision, Professor Kim?
The test we used was a PCR test or rapid antigen test. And actually, rapid antigen test is reliable only when it is positive. So this kind of screening was already having some hidden limitations, screening out any possible infections coming into our country. Anyway, I welcome this decision, and still we have to do the test within 24 hours after the entry, and it is most like other countries. Well, we need a backup plan to early detect any massive outbreak in the future, and especially a plan for elderly or people with underlying conditions. And recently I get a official letter from the health government that the emergency medical service should work more efficiently, because if a patient needs admission, it's not easy to find the available bed. So still, we are struggling with this kind of situation. We have to understand
I see.
that, yeah.
Meanwhile, Professor Chin Hong, the US, for its part, revoked this requirement of a negative COVID-19 test result upon entry to the US back in June, I believe. Do you suppose this move is an inevitable part, perhaps, of resuming life amid the prolonged pandemic?
I agree with that too, Sunny, and I agree with all of the points that Professor Kim brought up. You know, if you're using a rapid antigen test, we are getting more and more data showing that there are a lot of false negatives as well, because it's starting off in the throat, and if you do a nose swab, you may not get a positive test even though you have infection in you. Added to that, there's also been a big industry of fraud with people giving false negative tests that you can pay for. So I think there are multiple reasons why it didn't work, and it's reuniting families, it's allowing people to move more freely, and it's also affecting the economy positively.
Right. And Professor Kim, back here on the local front, Chuseok celebrations this year come with virtually no COVID-19 restrictions, as highway toll fees are being lifted during the holiday period to allow or encourage travel, and eating is also being permitted on public transportation, including trains and buses to hometowns. But regardless of this reality, I understand restrictions at nursing homes remain in place. And that being said, how is Korea faring with its treatment, care that is, of critical COVID-19 patients, including the elderly?
I always look at the pattern of this outbreak through the website Our World in Data, and we have a good news. This outbreak was because it came from BA.5 variant, and it had reached the peak in August 22nd. And since that day, it's declining in a very fast speed. So this is a good news. We have plenty of reason to ease in our quarantine measures for this Chuseok. This BA.5 outbreak started about the end of July, and I think by the end of September, this BA.5 might fade out, and we're going to be in a stable status. But vigilance is still needed, especially in a situation such as nursing homes and hospitals, any public space that elderly or people with underlying condition might gather. And right now, as we ease our quarantine measures, the person or the patient who has any risk factors should keep his personal hygiene very strictly. That will be a good contribution for our whole country.
Right, of course. And Professor Chin-Hong, what can you share with us about efforts there in the US to better protect and perhaps treat, of course, those at high risk?
Well, Sunny, there are two main interventions now that the US is banking on to protect the most high risk. Of course, there are vaccines, and vaccines, including boosters, which has been the emphasis for a long time. But added to that, for people who can't make their own antibodies, there's, of course, long-acting monoclonal antibodies like Evusheld. And on the other hand, even if you don't want to get vaccinations, there are now therapies like Paxlovid and at least 3 alternatives like monoclonal antibodies, short-acting, remdesivir for 3 days, and molnupiravir made by Merck. So all of these are options for people, even if you're not vaccinated and high risk, to keep you away from the hospital.
Right, and staying with vaccines, Professor Kim, bivalent boosters will be available here in the country starting from the 4th quarter. Is this an appropriate time frame, to protect the public from a very much anticipated rebound this winter?
First of all, we have to understand what kind of bivalent vaccine is it available. The bivalent vaccine from Moderna was against the original Wuhan strain and BA.1, which is also known as Omicron. For remind, Omicron do not share mutations with the most famous mutations previously occurred, and scholars do not know when did it started exactly. So still there are possibility for new variants to emerge or new subvariant to emerge. Recently, Pfizer also developed another bivalent vaccine, which is against the original Wuhan strain and BA.4 and 5. And well, for high-risk patients who might have already vaccinated many times or passed through previous infections, those people might be might gain some meaningful significance benefits from those bivalent vaccines. For the rest of the people, I still have to think about it, and we have to define whether this kind of bivalent vaccine is to prevent infection or to prevent severe cases. If it's to prevent severe cases, I agree with those bivalent vaccines, but I'm not sure whether it's going to prevent infection or not, because the Omicron outbreak is almost finishing, and actually we might have to prepare for a new variant to emerge, and we don't know whether it's going to be a subvariant of Omicron or a totally new one.
Right, there is the uncertainty there then.
Yeah.
Professor Chin-Hong, what is the latest with regard to the rollout of bivalent vaccines there in the US?
Well, today, as many people know, the FDA approved in the US the Pfizer and Moderna boosters version 2.0, which, as Professor Kim pointed out, includes not only the original Wuhan strain, but also BA.4 and BA.5. The original vaccines are spectacular at preventing serious disease, hospitalization, and death. But what it's hoped for, and of course we're not really sure yet, is that the new and improved boosters will also prevent or do a little bit better job at preventing breakthrough infections, because they've been very, very disruptive to society here, with people isolating at home, people taking time off work to take care of people isolating at home, schools being missed, workplaces being disrupted, even Broadway productions. So that's the hope, but we don't have a lot of firm data yet. But nevertheless, the Biden administration has bought 170 million of the new bivalent boosters in an attempt to really try to mitigate the effects of the virus on just everyday life.
Right. Professor Kim, the fatality rate of COVID-19 remains at 0.12% here in South Korea. I believe at least 44 children have lost their lives to COVID-19 since the start of the pandemic here in the country. I understand 29 of them were unvaccinated. And that being said, and speaking as a pediatrician yourself, what would you like to highlight about the importance of inoculation for children with pre-existing health conditions?
I used to say that the pediatric age group is relatively safe when they get infection with COVID-19, but this kind of my perception was wrong, and we do have mortalities, which is quite low still, but recently our team also experienced a fatality case. The patient had a very severe heart condition, and I think it was already critical, but COVID-19 was a kind of a final blow for this case. So yeah, it's highly recommended for those patients to have a vaccination, which is effective, and also we don't have to worry about the side effects. So I like Novavax as a good candidate for children because it has less side effects. And about little more than a half of those fatalities in children had underlying conditions. And this also means that the other half didn't have a underlying condition. So why those previously healthy children get sick and die because of COVID-19? Research is needed meticulously. And if there's any other new high-risk factors among children, it should be addressed, and those children should have vaccination as soon as possible.
Right, of course. Professor Chin Hong, the Biden administration, I understand, is reportedly planning to shift COVID-19 vaccine coverage to the private market as soon as next year. What are your thoughts on this particular plan?
Well, I'm a little bit worried, Sunny, because as many people know, the U.S. doesn't have a single payer. We don't have a national health system. So that means some people left behind. And of course, this is a public health emergency still. I think that they've already started diverting resources from testing into vaccines and therapeutics like Paxlovid. And Congress still hasn't approved the $10 billion we're hoping for to continue to pay for additional therapies. So unfortunately, it will probably go into the public and private market. And I'm a little bit worried, but we will try to cross that bridge when we get to it. And as I mentioned, they already pre-purchased 170 million new boosters. So hopefully that will help to ease the transition.
Right, hopefully. And staying with that, Professor Kim, what are your thoughts on South Korea possibly directing COVID-19 vaccine coverage to individuals themselves in the near future?
I think it's not a matter of yes or no. Right now, it's covered by the government. And for children, we have about 17 kinds of vaccines covered by the government. It's very famous ones. And if it spreads, it's going to be a very critical infections among populations, such as diphtheria, etc. And still, we have vaccines which is not covered by the government, which is a rotavirus and other kinds. So it's the decision of health authorities to evaluate COVID-19 and where it should be located. And as Professor Kim Moon mentioned, the bivalent vaccine is coming. And if the government has to decide, I think they will decide with those bivalent vaccines, not the vaccines we already had. And Korea has a huge outbreak in the early 2022. So most of the Koreans are infected with Omicron. And before Omicron outbreak, Korea kept the incidence of COVID-19 relatively low. So it's a little bit different from other countries. So that will be another point that the government had to consider.
Right. And moving beyond vaccines, Professor Chin Hong, amid the rebounds and retreats in COVID-19, some have suffered the misfortune of reinfection, while others have remained unaffected altogether. That being said, Professor, is there, do you believe, a genetic element, so to speak, that's possibly keeping them better protected?
Well, this phenomenon now has been termed novid as opposed to COVID. And I think most of the people who have novid, meaning they've had the same alleged exposure but not developed disease, probably didn't know they had it before. In fact, some of the data in the US suggests that as many of more than 70% already have had some exposure, even though they don't all add up to the official numbers. Genetics is possible. There have been some genes identified, but they're probably not contributing to a large proportion of those people who haven't gotten infected yet. Some of them also might be related to why people are not getting quite as sick as others. And there's also some contribution from drugs and even allergies. So it's a very complex picture, but something that's really, really helpful to science because it may help us develop therapeutics in the future.
Right, hopefully that will be the case. All right, Professor Chin Hong, as always, thank you very much for your thoughts today. And Professor Kim here in the studio, thank you very much for your insights.
Thank you.
Thanks so much.